So work hours were enormous. Currently, the number of residents in most government institutes, at least in Mumbai, Maharashtra, are much more. They are almost two and a half times. Like in KM now, there are 20 plus residents in a batch. So automatically, work has reduced a bit. So work hours at that time were easily 18 hours a day, easily, plus weekly emergencies. You had a great exposure in terms of the quality of work that the consultants were doing. So, exposure to laparoscopy at that time was not very common. Now everybody is doing laparoscopy, but I'm saying 15 years ago, laparoscopy was quite new. Still, there was a lot of lap work happening. We wouldn't get to do anything. JR3 maybe would get to hold the camera at that time. But you had exposure. Now there is robot in a lot of government hospitals, private hospitals. So exposure has definitely become better. Second thing is cutting. Now you always think that okay, if I am taking surgery, I want cutting, cutting, cutting. But honestly, even in a government institute, the cutting is more in emergencies. Like you'll get a lot of cutting that is debridements, amputations, gangrene, open appendectomies, maybe due perforations, laparotomies. That is the kind of cutting you get in emergency. Elective cutting in government institutes is not that much. Maybe in the first couple of years, yes, you'll get to do a lot of open hernias, hydrocele, but that's about it. More than that, laparoscopic work, very few institutes are going to offer to you as hands-on. So what will happen in most places is when you will finish your 3 years, whether you did MS or whether you did DNB, you will have a basic level. Maybe some of your peers would have done some things more, some things less. Like in some places, you'll get good laparoscopic exposure. In some places, you'll get good clinical exposure. Some places, you'll get a lot of cutting. But at the end of the 3 years, you will have a basic understanding, basic knowledge. And to do more than that, like if you want to go into private practice immediately after general surgery, you won't jump into private practice.